Hello and welcome to this episode in Sports Podiatry. Today we'll be talking about ankle sprains that cause pain and swelling. There are many structures on the outside of the ankle that can become painful and inflamed. These usually include ligaments, the peroneal muscles, and bones. With the ligaments, these connect bone to bone and can become stretched and inflamed. Muscles, including the peroneal muscles, can overfire and become problematic as well. And bones can become painful with avulsion fractures in the area. Lateral ankle sprains usually happen when you're rolling your ankle to the outside, which can happen from stepping on someone's foot, uneven surfaces, and side-to-side motion. Unfortunately, lateral ankle sprains tend to cause further ankle sprains because the lateral ankle ligaments and structures can become weak, loose, or lose their proprioceptive ability. Proprioception is a big part of why lateral ankle sprains can reoccur and can be seen as one of the biggest risk factors for recurring ankle sprains and ongoing pain. Proprioceptive ability is basically the ankle's balancing mechanism and can basically work to protect the lateral ankle ligaments and structures by feeding back to your brain about the ankle's positioning in regards to space. In the short term, clinical assessments and treatments should be focusing around assessing the extent of damage in the surrounding tissues to the joint and then further preventing any further injury or further inflammation to the area. Generally speaking, if the ankle sprain is severe, then offloading techniques should be used, and these can range from footwear modifications, bracing, strapping, orthotics, or even cam boots or crutches if the ankle sprain is severe enough. Clinical assessments are usually done within the chair and can include X-ray, ultrasound, or even MRI. Unfortunately, without proper rehab and proper treatments around ankle sprains, they tend to be really common to cause further pain and further re-injury as well. Long-term treatment plans around lateral ankle sprains should basically start as soon as the pain and swelling has decreased from the initial trauma and should focus around any potential deficits that you might have when it comes to a possible risk for re-injury. These can include basically treating any deficits in strength, any deficits in flexibility, any deficits in proprioceptive ability, which is again back to that whole balancing mechanism sort of situation. And generally, once these factors can be addressed, risk factors for re-injury should go back down to a relatively normal level. Proper treatment around lateral ankle sprains is very important. Often lateral ankle instability and ongoing pain can become a long-term issue for particularly our sporting patients around this particular injury. Today, information provided has been of a general nature, and if you feel like you have a particular concern, please book in online.